Hi, everybody. I am Dr. Joel Richnack, and wanted to thank you all for coming out tonight and joining us for this webinar, where I'll be discussing and hopefully imparting some more information on you all about this field of orthobiologics, this field that I'm very passionate about and have been for some time now. And hope to demonstrate and show you how this can be a very effective means to address these orthopedic injuries, these orthopedic issues that may not be responding to conservative care. And consequently, also show you how it's been a very powerful means to help people avoid surgery. And as Dana mentioned, we'll spend the first 30, 40 minutes just going over the slides and giving out information, but we'll certainly reserve some time at the end to address everybody's questions. That's usually kind of the bigger part of the webinar, is just addressing questions, and that's kind of fun. So anyways, a little bit about myself. Let's see, slides moving here. Okay, there we go. So I've been practicing in the field of physiatry, which is a musculoskeletal neurological specialty in this area, Grass Valley, for 18 years now, actually, where I've been a managing partner with my partner, Dr. Mike Jensen, at our clinic, Mountain View Rehabilitation. I am board certified in both physiatry as well as sports medicine. I've been a Regenexx affiliate for close to 8 years now, actually. But to be fair, I've been practicing some form of regenerative medicine since residency, so for close to 20 years now. I feel another important part about myself is that I've had a very active lifestyle throughout my whole life. I was fortunate to grow up in the beautiful mountains of Sierra Nevada. And initially, these activities were just means to help me explore and have adventures in these beautiful mountains. Eventually, these activities triggered my curiosity to learn more about the human body and how this body ticks. And so certainly that eventually fueled my passion, my desire to go into orthopedic medicine. And then certainly, like anybody who's been active, I've had my fair share of injuries over the years. And although injuries are frustrating and what have you, I really found them to be an opportunity to learn more about myself, about how to heal from these injuries, about how to get back to doing the activities that I love doing that the injuries may be preventing me from doing. So activity, this active lifestyle has been a real guiding force, if you will, throughout my life. And in addition, given all that, it's also fueled and helped me define what truly is our main treatment philosophy here at Mountain View Rehabilitation. And that is, we really have a passion for getting people back to doing what they want to be doing. I know the importance of that. So, I mean, that really is our underlying treatment philosophy. Now, why are you all here? Well, more than likely, you're in pain of some sort or another. And this is causing downtime. It's keeping you from doing perhaps your own activities that you love to do. You're looking for alternatives to surgery because you're trying to avoid surgery, or maybe you've been told you're not a surgical candidate. You're looking for options. Perhaps conservative treatment was not effectively able to address your issue. You're looking for other things to consider. Some of you just don't want to be on meds anymore. Meds, as you all probably know, really ultimately prove to be a Band-Aid. And most importantly, you want to get back to your active lifestyles. So in today's discussion, we'll cover a few topics. First, we'll kind of jump into current options in orthopedic care. Many of this will be familiar to, or many of this will be familiar to most of you. And then we'll introduce this field of regenerative medicine, as well as another field called interventional orthopedics, which really makes orthobiologics work. And then I'll talk a little bit more about this field, this company of Regenexx, which I've been an affiliate with for some time now, and how Regenexx is quite different than any other clinics that may be offering orthobiologics. And then we'll go over some clarifications about misrepresentations that are out there regarding quote unquote stem cell products. And then we'll finish up with a little Q&A. So current options for orthopedic care, most of you are familiar with all this. Most of us start with some sort of pharmaceutical pain medications in hopes of addressing pain. That doesn't quite address things, and we kind of look into conservative treatments. And then if that fails, typically the protocol leads to perhaps surgical consultation to see if there are surgical solutions for particular issues. So again, many of us start with just over-the-counter medications in hopes of addressing pain that may help address the specific orthopedic issue. If that doesn't work, oftentimes we go see our physician, or we may be prescribed pharmaceutical strength, anti-inflammatory, or even pain medications, or even steroids. But most of us learn pretty quickly that these are temporary band-aids at best. And just about all meds have side effects, and some of them can be quite serious side effects. So the next step in this journey to healing involves conservative treatment. And conservative treatment, as you all know, typically involves physical therapy, bracing, chiropractic treatment, acupuncture treatment, even massage. And to be fair, as a physiatrist, I'm a rehab physician. And so I strongly believe in the rehab protocol. I explain to every patient who comes into the clinic that there's two goals to treatment. The first is you're trying to get the pain addressed, first and foremost. Once the pain has been addressed, then the next step is working on a rehab routine, which predominantly is focused on trying to correct the mechanical deficits that may have contributed to the injury in the first place, but also to help provide stabilization so as to avoid re-injury. But again, if the conservative treatment is not effective at addressing that pain first and foremost, to allow the rehab to take place, then sometimes we resort to injections. Most of the time, it's going to be a steroid. Insurance for some folks does cover this other type of injection called hyaluronic acid, which is specifically used for addressing knee osteoarthritis. And again, the hope with this is that it can address the pain for a period of time to allow the rehab process to take place. But sometimes that isn't the effect. But again, I always like to point out that the vast majority of times, the rehab process is effective for most people. Problems with injections, particularly with steroids, is obviously there are side effects. Most importantly, if one gets too much steroid in a tissue or a joint, then that steroid really can break down the tissue or cause further breakdown in the arthritis. And so following that protocol, if the conservative treatment fails, then typically the next step is going to see a surgeon to see if there might be a surgical solution for the problems. And this typically involves either removing your tissue or repairing your tissue, or in other cases, actually replacing the entire joint. And certainly there's a lot of cases where surgery is very effective, but it's not the perfect panacea. There are cases where it doesn't work. There are risks to surgery as well as the anesthesia that's involved with surgery. And again, it doesn't always work. And of course, finally, you can't undo, particularly a joint replacement procedure. Now, interestingly enough, in the last 5 to 10 years, there's been more research looking at the outcomes of surgery in the last 5 to 10 years than there has been in the previous 100 years. And much of this literature is telling us that surgery doesn't always work. there's lots of holes in surgery. In fact, these studies have shown that 53% of surgery is ineffective. And so this begs the question, what else is it? What are the options? And that will transition to us to what we'll talk about for the rest of the evening, and that is this world of regenerative medicine, where namely we're using either platelets and or stem cells to help repair injured tissue, such as tendons or ligaments, meniscus, labrums, nerves, and discs, or in the case of degenerative conditions, help alleviate symptoms and help restore that joint's healthy state, if you will, what we call homeostasis. So what areas can be treated? Well, in our clinic here, we're addressing all areas. We address knees, shoulders, hips, the entire spine, cervical, thoracic, and lumbar, elbows, hands and thumbs, feet and ankles, and all these joints have very specific tissues that is treated. It could be the tendon itself, it could be a ligament, it could be the joint, it could be a compilation of all three. So usually when we're treating with orthobiologics, we're treating a number of different tissues that are involved in that particular joint. What is interventional orthopedics? Well, this is a field that really ensures the success of regenerative medicine, of orthobiologics. And essentially what it is using guidance, namely the use of technologies such as ultrasound or x-rays to help guide the injection procedure specifically to the tissue in need of healing. Now, the correlate to this is a field called interventional cardiology. Now, many of you may recall some time ago, as long as the 70s and the 80s, if anybody received any type of cardiac procedure or heart care, usually you'd go see a cardiothoracic surgeon who would access the heart by opening up the chest and doing the procedure from there. Back in the 70s and the 80s, there was some very savvy cardiologists who discovered that by using similar guidance, such as an X-ray machine, they could guide a catheter implanted into a vessel in your leg, guide it up to the heart, and then from there, able to apply treatment, do the procedure, and thus invented a method that was minimally invasive. And the effectiveness of this equaled, if not even surpassed, cardiothoracic surgery. But of course, the risks were far fewer, and the recovery was a fraction of those who got the cardiothoracic approach. And of course, the expense is quite a bit less as well. So introducing this world of interventional orthopedics has a similar means of basically doing and treating these orthopedic issues with minimal innovation. And ultimately, the interventional cardiologist, those procedures basically took over 70 to 80% of what cardiothoracic surgeons done. The thinking, certainly by the greater minds in this field of interventional orthopedics and orthobiologics, is in the next 5 to 10 years, we'll probably see a similar change in orthopedic surgery. It's that powerful of a specialty. So again, it's minimally invasive, it's needle-based, it's image guidance, and basically over 85 different injections that can be done using your own tissue, your own cells. Now, diving into this a bit further, anybody who's involved in the world of orthopedics, there's a variety of procedures that can be done, from simple injections to surgery. And the vast majority of people who practice orthopedics do simple injections, where they take a needle level of cortisone, they pop it in the area of the joint in hopes of getting that medication to filter its way, find its way to the area of injury, and hopefully calm down the individual's pain. Now, with the advent of technologies such as ultrasound, and with the cost of ultrasound coming down, many physicians have added ultrasound to their clinics to help with this process. But these folks still may not be doing precise injections. Again, they're using the ultrasound to get a little closer to the tissue. But again, it may not be a precise injection. And this is in contrast to interventional orthopedics, which is a small percentage of the entire orthopedic population, who first and foremost are going to take a joint, such as in this case, such as the hip joint, and first of all realize that there's a variety of tissues within that joint that could be contributing to the pain issue, or several of them. So first and foremost, what we're doing is giving accurate and specific diagnoses. And once that's done, then we use the ultrasound or the X-ray machine to help target that specific tissue. Again, whether it be tendon, labrum, joint, or sometimes even into the bone. Same holds true for a knee joint. Again, there's various tissues that could be contributing to the pain issue that could be injured. And again, the first job is first and foremost identifying the specific tissue and then treating the specific tissue. And likewise, the shoulder as well. So again, specific diagnosis followed by a specific treatment and specific placement of these cells to the injured tissue. What do we inject? Well, three products, if you will. One is concentrated platelets, another is platelet lysate, and finally there's stem cells. Now, platelets, otherwise known as platelet-rich plasma, is a cell that we derive from the blood. So it starts with a blood draw, and from that, it's sent to the lab where it's processed into very concentrated platelet solution, if you will. And platelets are rich in growth factors and cytokines, these various proteins. And cytokines are proteins that basically mop up bad chemicals, various inflammatory products that forestall or even prevent injury, but also cause pain. And once that's removed, then the growth factors take over and really rev up that healing and repair mechanism. And so we're using platelets to treat mild to moderate arthritis, as well as tendon and ligament tears, but also we're using it for meniscal tears and even labral tears. Platelet lysate is a subset of platelet-rich plasma, in which the lab process, what they're doing is they're able to break up the membrane surrounding that platelet. And what that does is it makes immediately available these cytokines again. And we're finding by using the platelet lysate, we can get the same anti-inflammatory effect and the same healing effect without creating as much of an inflammatory response. Where pure platelet-rich plasma can create initially an inflammatory response. And this is proved particularly valuable around nerves. So we're using this to treat carpal tunnel, pinched nerves from the spine, or other nerve issues. And again, the idea with that is it tends to be more effective because it isn't quite as inflammatory as pure platelet-rich plasma. And then there are stem cells. Stem cells are basically the chief cells, if you will. They're general contractors, or another way of describing stem cells is they're kind of like the conductor of an orchestra, in the sense that what they do is they coordinate this vast milieu of players that are involved with the healing process to actually repair tissue. And we get stem cells from a bone marrow aspiration. And again, there's a lot of process there afterwards. And again, as far as healing potential, stem cells probably definitely are our most potent cells to offer healing. And so we're using this for more moderate to severe arthritis or for more severe tendon or ligament tears. Now, typically our procedure breakdown, 80% of what we do are platelet injections and 20% of what we do are stem cell injections. And I bring this up simply because to emphasize the point that platelets are very, very powerful healing cells. And that's important because not everybody needs a stem cell procedure. Sometimes stem cell is overkill. And another important factor of this is that platelets are quite a bit less expensive than the stem cell because they're a little more simpler procedure, if you will. And I'll explain that a little bit more in a little bit. So what is Regenexx? Regenexx is a company that I've been affiliated with for almost 8 years now. And, you know, Regenexx is really a pioneer in this field of orthobiologics. I mean, they have discovered and implemented a lot of these techniques that are involved with interventional orthopedics. They've been really the pioneer, the trendsetter as far as you know, advancing this field, advancing the laboratory process, advancing the clinical process. I mean, they've really pushed this field more than any other clinic out there, or any other organization, if you will, that's offering this type of technology. So what makes Regenexx different? Well, and I had to answer that question for myself before I even became an affiliate. And what stand out for me the most, and really the reason why I became an affiliate, was they are devoted to the research of this field. And I've discovered through my practice over the years, having seen many different technologies come and go, the real big difference as to why one technology is going to succeed and one fails is the research. I mean, to prove that this technology works and to find out who it works best for and to find out the best ways to provide optimum response to it, the research is an ongoing process. I mean, we're still early in this field, so research is critical. And really, the Regenexx Corporation is the leader in the research. So for me personally, that was the reason why I became an affiliate. But there are other reasons that Regenexx is different than any other clinic that's offering these procedures. And we'll go over all these various ways from the research that I mentioned before, lab platform, all these different ways. Oddly enough, this is not what everybody is doing. And we'll jump into all these here. As I mentioned, the Regenexx Experience, they've been doing this far longer than anybody else out there. The Regenexx Corporation was founded in 2005. And as I say, they invented many of the procedures as well as the processing that makes these cells available. And so ultimately, what does this lead to? Well, with experience, you know, the outcomes are, the potential of a greater outcome is to be much greater. Our lab platform is far different than any other practice out there. You know, most clinics providing this technology are using a bedside centrifuge, which means they do the blood draw, they put the blood in a centrifuge, hit a button, 5 minutes later, out comes a product and you get the injection. What that means is everybody gets basically the same dosage, the same you know, medication, if you will. And we've certainly found over the field, over the course of time, that dosage is important. Another important reason why our platform is different is that we can concentrate both stem cells and platelets far greater than the other bedside lab platform clinic. And again, those two factors ultimately lead to much greater outcomes. And you know, understanding that everybody's different, whether it's your age, your sex, your body habitus, condition, and therefore, you know, customized treatment always works best. And again, that's going to optimize outcome. Our cell source, and this applies specifically to stem cell, is we get our stem cell from a bone marrow aspiration. So anybody who gets a stem cell procedure, we're aspirating your bone marrow, and from that, getting the stem cell. And the reason for that is that this is the only means of legal means of obtaining stem cells. You know, bone marrow is, there are other means such as fat and something else called the amniotic injections, which we'll touch upon later. And these are, you know, first of all, not legal. And second of all, the research behind the bone marrow is far greater than these other products. And again, it has been a proven means of being a very effective healing source. Harvesting, we have developed techniques over the course of time. The harvesting applies specifically to bone marrow aspiration again. And we've developed techniques that can help optimize the number of stem cells that we can get from the aspiration. And that's important because ultimately, the more stem cells we can obtain, the greater the healing potential. And once again, the greater outcomes. And again, these are techniques, and we found this to be the best technique. Dosing, as I alluded to earlier, is important. At the end of the processing of stem cell, we have tools that can help measure the number of cells. Again, it's important to apply the proper dosage. So we've discovered that a certain amount of stem cell is optimal for healing somebody in their 30s and 40s versus a different amount for healing in your 70s and 80s. Likewise, platelets too. We've found that by increasing concentration to 15 to 20 times baseline normals is much more effective as we age. When we're younger, we need 5 to 6 times or 10 times baseline. So again, understanding dosing and again, really catering towards customizing the dosing for each and every individual, once again, does improve patient outcome. I alluded to this and explained this in detail earlier, the importance of guidance. And again, just in summary, without guidance, there's no way this technology is going to be a fraction of effective as it could be with guidance. It really is the key to making sure that this technology works. If the cells aren't getting to the tissue in need, it's just not going to work. Now, Regenexx data registry, this is a whole other aspect of research that Regenexx has taken on for over 15, 17 years now. And what this is anybody who gets Regenexx procedure is invited to join our registry. And what that means is they'll receive questionnaires. The first year, I think there's 2 or 3 different questionnaires. As the year goes on, and they go down to once a year. And basically what we're tracking is just how people are doing. And so, we are following over 20,000 patients at this point. And so we have a data registry. This database is huge. And this database fuels all of our literature, all of our published literature that we have published over years. And that has led to publishing over 44% of the world's literature on this topic. So it all starts with, following our patients and gathering that information through the registry. So ultimately, we're not guessing here. We want to know what's happening with our procedures. And then the clinical research, again, this is critical. The Regenexx is finally is constantly, I should say, tweaking the system, if you will. Always looking for ways to make this work as best as it can. As I say, we're still early in this field, so there's still a lot to learn. If we don't keep doing the research, we're not going to make this product as good as it possibly can be. What we're offering now is far better than what was offered 10 years ago, and that will continue over the next 10 years. The lab research is important too. As I say, the Regenexx Corporation is constantly trying to tweak the system to optimize it and make it as good as it can. And that is also lab research too. Again, I was alluding to earlier that our lab process is a little different than just a simple bedside centrifuge. We do have centrifuging processes that we do 3 or 4 times through the course of processing, but in between each centrifuge processing, that product is taken to a hood where various tools are used to pull off certain layers to help optimize the number of stem cells or the concentration of the platelets. Anybody who's a Regenexx affiliate is a specialist in this field. We are all musculoskeletal physicians. This is our passion. This is all we do. Anybody who gets a procedure from us, you're getting it from the physician. Whereas many of these other clinics may not be a physician at all. It could could be a nurse practitioner or a physician's assistant. In other cases, it could be simply a family practitioner, somebody who's not necessarily only doing orthopedic medicine. And again, I certainly believe that, as a specialist, and this being our passion, this being, our main focus, that leads to better diagnosis and ultimately better treatment and ultimately better outcomes. So just to explain briefly the procedure flow. So for platelets, we start before any procedure. Anybody is going to come in and get an initial evaluation where we spend an hour with you, getting down your history, doing a full physical exam, and reviewing your MRI or X-ray, whatever imaging study may be. And from that, we'll again provide a diagnosis, provide a recommendation, as well as a prognosis of what you can expect after the procedure. And if one decides to go through with the procedure, then the next step is scheduling, coming in, getting a blood draw. Once the blood's drawn, again, it goes to the lab where it takes about an hour plus to process. So therefore, we do the blood draw in the morning, bring you back a little bit later in the morning for the injection, which is followed by rehab if necessary. And then we always see people and followed 2 months afterwards. With the stem cell, it's a little bit more involved. Again, it starts with the initial evaluation. Then if one decides to go through with the procedure, it's a 3-day procedure, usually done on a Monday, Wednesday, Friday. Day one is an injection using what we call Prolotherapy. And this is just simply an irritant that we place in the tissue or the joint. And what that does is it tills the soil, it gets the tissue ready for the stem cell that we do 2 days later. The stem cell is a 2-part procedure. It starts with a bone marrow aspiration. We get bone marrow from the back of the hip. We numb up the individual thoroughly. So, interestingly enough, getting into the cavity, most people don't notice that too much. When we start pulling the marrow out, it does get a little bit sensitive. We do it real slow. Most people tolerate just fine. Once that's completed, it goes to the lab. And in this case, it takes 2 or 3 hours to process the bone marrow into the stem cell. So we should do the aspiration in the morning, bring you back in the early afternoon for the re-injection. And then that's followed 2 days later by the platelet procedure, where again, we get blood from the blood draw, bring you back in later, a little bit later in the morning for the re-injection. And we find that it's important to add platelets to our stem cell procedure because the platelets have all the growth factors, if you will, the fertilizer, to help optimize that healing response. And once again, that's followed up by rehab, and then a follow-up visit 2 hours later, or a few months later. So that's the basics, if you will, regarding interventional orthopedics, as well as biologics, and this affiliate of Regenexx that I'm involved with. We'll spend a few minutes just going over stem cell hype. Like any new and exciting technology, there's bound to be bad players out there. And we're finding one of the biggest culprits, if you will, the biggest areas of abuse is in this world of amniotic injections, where they use either amniotic fluid, or sometimes it's called placental fluid, or even cord blood. And the issue is not so much the product itself, because this product does have growth factors, but most of the folks doing this procedure are calling it a stem cell injection. And the fact of the matter is there's been a huge number of university-based labs that have tested this product, and they discovered there's absolutely no live stem cell, no viable stem cell product whatsoever. It's essentially dead tissue. And based on all this research, the FDA has regulated this as a dead tissue product. So anybody who's advertising it as a live stem cell procedure, the FDA has considered that illegal. And over the last couple of years is making a very strong attempt to shut these clinics down. And they've done so quite a bit over the last couple of years. In a sense, it is fraud. As I mentioned, it doesn't mean that it's not the world of biologic. It does have these growth factors, But in terms of potential of healing, it doesn't hold a candle to the platelets, let alone stem cells. So, really we're finding that the platelet is a much more powerful tool than the amniotic. Many of these procedures have been done in chiropractic offices, usually without guidance, oftentimes done by a physician's assistant or a nurse. Once again, these are dead cell products. And another thing that's always, I found always a bit astounding is that the cost of these procedures are practically as much as a stem cell procedure, far more expensive than a platelet injection. And again, the potency of this is far less than platelets. One marketing tool that they use for this is they tell folks that their stem cells are simply too old to be effective. Well, if that were true, many of us wouldn't last over the age of 50. There's been many peer-reviewed articles that show this simply is not true. We treated people as old as 97, and they still did well. Studies have shown that people in their 70s, 80s, 90s, their stem cells are equally as effective as somebody who these people aren't doing any worse than people who are young with younger stem cells. So, as you're doing your research for in this field of orthobiologics, look out for some of these red flags. One is discounting and heavy on assisted financing. What I just rolls my eyes more than anything is they pretend to treat just about anything. The hair loss or anything under the sun. Most of the research out there does back up orthopedic issues. Most of the other research is still very much in question. Everybody is a candidate. They don't turn down anybody. That's the big red flag. And once again, calling it a live stem cell, that's just simply fraud. And that applies to cord blood. And fat at this point is still illegal. Although fat is a promising orthobiologic, but again, it's still considered illegal. So in summary, we've certainly in my clinic, I've seen over the years that this approach with orthobiologics really is a powerful means of helping people heal and become pain-free and get them back to the passions, the activities they want to be doing without surgery. This combination of orthobiologics with interventional orthopedics really is a powerful tool for achieving this. Regenexx, once again, one of the leading providers and researchers of this field in the world, for that matter. Always be cautious of the magic stem cell approach. So that's the bulk of the presentation. Before we jump to our question and answering session, I just want to leave this on the screen. And go ahead and copy that information down. If you have questions after our webinar tonight, don't hesitate to contact us. Or certainly if you want to come on to the clinic and be evaluated to see if you might be a candidate for this technology, if you will, please give us a call and we can try and set that up and provide that information with you. So with that, why don't we go to our question and answering process? And I think Dana explained already. Just simply, there's a little button on your screen there to raise your hand. Essentially, to simply raise your hand, and again, I'll click on your name, and the whole crowd will be able to hear your question, and then I'll answer the question as best as I can. So, any questions out there? And while people may be forming their questions, Dana, are there anybody who's written in a question? Because that's always an option too. Here's some come in now. So let me click on David. Can you hear me?
Yes. Can you hear me?
I can hear you. Yes. How are you?
Good. So I've been in contact with your office a bit now, sending some information down, and I'm just really trying to get an evaluation. But in doing some of my research, I have a left hip that is in pretty bad shape, pretty much bone on bone. And from some of the other information your staff has sent me, that these are not good candidates for stem cell or PRP.
Yeah, I mean, hips, I would say, are probably one of the least performers, if you will. Most other joints really do have, respond well to this, but hips, not always the case. And we're not quite sure why that is. One of the reasons we think that might be the case is, for whatever reason, hips can go downhill pretty quick, much quicker than any other joint out there. So, if there is true, complete cartilage loss, or in the cases of, more severe arthritis than that, sometimes we get bony findings of edema in the bone. And in end stage arthritis, we'll even see the bone, the head of that hip joint flattening out. I mean, particularly if it's in that scenario, I wouldn't waste your time with stem cells. But I mean, it doesn't mean that, if we can catch it early enough, or if we can catch it before it starts collapsing, doesn't mean you won't respond. But, the prognosis may be, you have a 40 to 50% chance of responding, as opposed to a 70 to 80% chance that we might get with, say, a knee or a shoulder or something else.
So an evaluation would be in order then?
Yeah, an evaluation. And oftentimes, if it's severe arthritis and we're considering stem cells, oftentimes we'll try and get an MRI as well, just to see the status of the bone.
Okay, I will work on scheduling that with you. Thank you.
Okay, you're so welcome. Thanks for joining us tonight. Thanks for the question. Okay, well, any other questions out there? Okay, Bob, can you hear me?
Yes, I can hear you.
Hi, how are you?
Doing well, doctor. How are you?
Good. Haven't seen you for a little while.
Yeah, it's been about 10 years. And I did stem cell transplants with you. Or maybe
I remember.
Maybe it was eight years, because I think I heard you say, okay.
Yes, no, I think it was 7 or 8 years ago. Yeah.
And it worked just extremely well for me. It was an amazing transition for me.
Fantastic.
Yeah, and recently I twisted both knees in 2 different little falling incidents that were not age related, but stupidity related.
Yeah.
And I'm having issues again with my knees. So my question was, you harvested enough stem cells from me to be able to do both knees at the same time, and my question was, over this 6 to 8 year period, is it typical that these stem cells grow back, or or is the population decreased and never really recovered from that?
You mean from the aspiration itself?
Yes.
Oh, absolutely. I mean, that any stem cell that we take out of the bone marrow regenerates itself. Most of it is regenerate within 4 to 6 weeks. We usually say 3 months to get full recovery from that. But absolutely, I mean, you're constantly making stem cells. I mean, your body is constantly making stem cells.
Okay, so the next question is, what is the current procedure? Or do you require an MRI first, or do you require scheduling to evaluate? And I know that the procedure is not covered by Medicare.
Right.
But would an initial consultation be covered by Medicare?
Absolutely. Yeah. No, I mean,
okay.
Anytime we see any office, Medicare, and most insurance, we take most insurances for that matter, that's covered. Typically, the MRIs are covered if that's necessary. If bracing is necessary, that's covered. I mean, I would suggest maybe just making an appointment, and we can reassess. I mean, if it's not back to that baseline levels that you're having 7 or 8 years ago, you know, sometimes we can get away with just like a platelet booster, but other times, I mean, we are finding that the life of stem cell usually is between 7 and 10 years, and you're kind of right in that ballpark. So, but you know, the evaluation would really help kind of determine where that might be.
Great. I will make it a point to do that and see you again. Thank you.
Sounds good. I look forward to it.
Thanks, doctor.
All right. Take care. All right. Next question is from Linda. Hi, Linda. How are you? Can you hear me?
Can you hear me now?
Oh, yes, there you are. Hi, how are you?
I was wondering what was the cost of the procedures between the PRP and the stem cells?
Well, so for you know, depending on if it's one joint, two joint, you know, for one joint for platelets, we're charging around $1,500 for the single joint. If another joint's added, I think we add an extra $400 or $500 for the second joint. For stem cell, for one joint, most of the time, if we're just doing the joint, we're charging $6,500, and I say it that way because sometimes we have to inject into the bone too, and that might add, you know, another $1,000 or so for the single joint.
Okay, and would you ask me?
Success rate.
What's the success rate?
Well, and that's a good question. I mean, it really depends on the individual. And I always like to explain, you know, people who do best with this procedure are people who take care of themselves, you know, namely, you know, are exercising, have good diets. And the reason for that is those two ingredients, if you will, really optimize this foundation of healing in the body. And so, you know, if you have that going for you, it's really going to help with, you know, getting the number of stem cells that we can get from your bone marrow. But again, it's that foundation. That individual's going to have a strong healing foundation. And other things that we assess too are medications, because there are certain medications that can impair healing. And then depending on the issue, it depends on, you know, the MRI or, you know, imaging that's done. So we try and put all that together. But I would say that the most important factors are, again, you know, if you're active and you have a decent diet, most of the time, you know, if you're a good candidate, I mean, you know, you have a good 70–80% chance of doing really well with this.
Okay, thank you.
You're welcome. Well, thanks for that question. Let's go to Jack. Can you hear me? Jack, can you
hear me now?
There you are. Yes, I can hear you.
I just wondered if this was going to be put online and I might be able to send it to 2 other people that also have problems.
Yes. So once we're done tonight, we'll kind of package it up, and then it should be available. I believe Dana's going to actually send that to all participants probably tomorrow. So yes.
Okay. Thank you very much.
You're so welcome. Thanks for joining us tonight. Let's see. So next question is from Karen. Can you hear me, Karen?
Can you hear me? Hello?
There you are, yes.
Oh, there I am. Hi. Yeah, how would you handle severe plantar fasciitis that's just not responding to any other treatments for like many months?
Oh, okay. Has an MRI been done yet?
Yes.
And were they able to tell you if it was, you know, inflamed tissue or tear or a complete tear?
No confirmed tear, just, severe tissue.
Okay.
Yeah.
Well, so in most cases, we're treating that with a platelet injection.
Hmm.
I mean, if the tissue is still intact, or even, even if we're dealing with partial tears, we're finding platelets more than effective at addressing those issues. I mean, I had tears to 2 rotator cuff tendons in my shoulder that were almost complete tears. I mean, it was 80% torn, and that still did really well. So yeah, I mean, platelets are very powerful, very effective.
Okay, well, thank you.
You're so welcome. Thanks for doing it. Okay. Linda, I'm gonna let's see. Nope. Okay. Any other questions out there? And again, Dana, if you have anything written down that somebody may have texted in, might be a good time to throw that in too. Any other questions?
There were several questions that came in about insurance coverage, and it just needs to be clarified that these procedures are not covered by insurance. While the evaluation typically is covered by insurance, the procedures themselves are not.
Correct.
So,
Yeah. Just a caveat to that, though. I mean, that world is slowly changing. I mean, there are certain companies who can afford their own independent insurance. And these companies, these particular insurance programs are covering Regenexx specific procedures because they see the cost savings of treating this minimally invasively as compared to surgery. So, although it's not the big public insurance companies, it's a big first step. And, over the course of time, that will change. I'm seeing one question from Rosemary. Can you hear me? Rosemary McDermott? Can you hear me, Rosemary? Maybe hit your volume or some sort of technical issue, maybe. Can you hear me, Rosemary? Well, sorry, must be some sort of technical issue.
I have another question that's come in. It says my left hip has a lot of pain, and I had an MRI done, no bone on bone, but significant degeneration, narrowing, arthritis in hip. What would you recommend? Would this help?
Well, depending on the severity of that, I mean, we've done, if it's milder arthritis, we've done platelet injections that have been effective. Again, particularly with the hip, if we can catch it early enough, that's always a good thing, because the earlier we can get it, the better chance of success we're going to have. Because, again, the hips aren't our best responders. We've had plenty of people who've done really, really well, but not generally our best responders compared to other joints anyways. Any other written questions? Let's see here. Let me scroll down the list here. Let's see if we can get Stella, can you hear me? Stella, can you hear me?
Can you hear me?
Oh, there you are. Yes, I can hear you.
My question is, what is the procedure for this stem cell or bone marrow? Are they the same? Are they different? And how long does it take?
Well, so the procedure, it's called a bone marrow aspiration. And that's part of the stem cell procedure. So the bone marrow aspiration is the procedure we do in the morning to actually get bone marrow. And that takes, I mean, when it's all said and done, I mean, there's a numbing process and the aspiration process. I mean, that process itself takes 30 or 40 minutes. We allow an hour for it. Once that's done, the bone marrow goes to the lab where it's processed, and that's where we get the stem cell. So that's part of the stem cell procedure.
I see. And where does this take place at?
Everything is done in the clinic here. Yeah, we got a lab, we got a procedure room.
Where is that at? Where are you located?
Oh, we're in Grass Valley.
Grass Valley,
Where are you?
Sacramento?
Oh, okay. Yeah, so just it's 30, 40 minutes north of Auburn, northeast, I guess.
Okay. And do you, it's quite expensive. Do you have financing available?
We don't personally, but we do deal with a company who does offer financing. And we can certainly set you up with that information if necessary.
Okay, thank you very much.
You're so welcome. Thanks for the questions.
I will look into it more.
Okay. Thank you very
you.
much. All right. Take care. All right. Well, any other questions from the email, Dana?
There was a question about hip bursitis.
Uh-huh.
Just wondering what if it would work for reported bursitis in the hip.
So yeah, we treat this and I mean bursitis is a bit of a misnomer when it comes to these lateral hip issues. Usually it's a tendon issue. We usually verify that either through MRI or even ultrasound imaging. And again, vast majority of the time we're able to address this with a platelet procedure. Again, platelets work really well on these tendon issues. And there's an associated bursitis with the tendon issue because we never see bursitis all by itself. Usually it's involved with a tendon issue. It's also very effective at addressing the bursitis as well. So we do that particular procedure quite a bit. Well, if that's it from our electronic questions, let me just say that again, I mean, if you do have any other questions after tonight, don't hesitate to give us a call and we can try and address those questions for you. And again, if you wanted to find out if you are a candidate for this procedure, give us a call and schedule an initial evaluation. We can go through all your information, your history, do an exam, give you an idea of what you can expect from this procedure, and just go from there. So if that's it from your end, Dana, then I think we're probably pretty much good to go. Is that it?
Yep, that's all I've got.
Okay. Well, once again, I want to thank everybody for attending our webinar tonight. Hopefully I was able to offer you a little bit more information to fill in the picture of this world of orthobiologics. But again, please don't hesitate to give a call or contact us if there's any other further questions. All right, well, take care, everybody. Bye-bye.